Here we used Simpladent BCS implant, 2 implant to replace lower 2 central incisors. We did this in around 2015. This X-ray was taken in 2019. The patient came again in 2020. It's almost more than 5 years follow-up. We are given a zirconia crown. Both these 2 implants are functioning very good, but if we treat this same patient again, we would have preferred only 1 implant instead of 2 implant. 1 implant is more than enough for replacing 2 incisors. We will analyze the axial view now. If you see the axial view, you can see the implants are too close to each other, especially near the apical part. So this is the crown part. This is the neck and shank portion. So in the apical end, they are very close to each other. Placing implant this much close may interfere with the blood supply of this in between bone and may lead to implant loss. However, these 2 implants survived. Better to place only 1 implant in this kind of situations.